So yeah, we presented at this Congress a large SEER analysis to understand the prognosis of patients with small triple-negative breast cancers. And I think it's important because these small, less than 2 centimeter, stage 1 breast cancers are very frequent. About 1/3 of all triple-negative breast cancer are diagnosed in stage 1. And we haven't had much innovation in this category of patients. For larger tumors, we have immunotherapy, we have PARP inhibitors, we have novel regimens, and also ADCs being tested. But for stage 1 triple-negative, we have very little prospective data and very little drug development. And so I think it's important to put some focus in this category of patients and tumor, especially because several retrospective trials have already shown that these patients can experience, unfortunately, recurrence. But we wanted to look in a larger data set, this question of the risk of recurrence, and also what could be the impact of chemotherapy treatment and how chemotherapy has been used in the last few years. And what we did was looking at the SEER database, data from women that had stage 1 triple-negative breast cancer, and we had data of more than 8,000 patients. And what we realized is that depending on the size of the tumor, T1m, T1a, T1b, or T1c, it could really make a difference in terms of risk of recurrence. In general, all patients had more than 90% breast cancer specific survival at 5 years. But when we look at the benefit of chemotherapy, most benefit was really seen in patients with T1c tumors, so between 1 centimeter and 2 centimeter, where we saw a statistically significant advantage in breast cancer specific survival after adjusting for confounders. And also interestingly, we found that between 2010 and 2019, there was an increasing use of chemotherapy for patients with T1b and T1c tumors. And there are some predictors of use of chemotherapy in these populations, and in particular, larger tumor size, married status, younger patients, high-grade tumors, and in general, many features also associated with higher risk. What we hope is that we can improve upon this, and this can be the starting point for developing also prospective trials to improve outcomes in stage 1 triple-negative breast cancer.